We have Dr. Erica joining us through FaceTime this morning to talk about some of the mental health issues that have been coming up since all this quarantining and shelter in place began. So good morning, Dr. Erica, and tell us, what are some of the biggest mental health issues you've seen coming up?
Good morning. Yeah, we've really been hearing a lot about this lately from our patients, from our friends, from our family members. We get the anxiety and the depression. There are so many facets to this right now. From an anxiety standpoint, people worried about their own health, what would happen if they got COVID, their family members, their close friends. We're also seeing a lot more kind of anxiety about the germs and the obsessive compulsive tendencies. And we're telling everybody to wash their hands. And some people, it's really dominating their life thinking about that. And then a big one is the financial security right now, job security, food security for people who have had changes to their employment, and then worried about other health problems. So those don't go away during this time. Worried about if they're having chest pain, if they're having abdominal pain, and do they go to the ER? Do they call their doctor? What do they do during this time? There's just a lot of uncertainty and feeling a lot of out of control. And then there's safety issues in the home with domestic violence issues, even, depression as well with people. And these are all in people who maybe didn't even have depression or anxiety going into it. And then certainly people who struggled with this beforehand, but people are feeling really isolated and they're missing their friends and their family and they're missing their coworkers and they're sad about the uncertainty in their job and finances and retirement and all of that. And it's all coming together to be quite a big sort of mental health storm that's going along with COVID. Then there's the stress of just homeschooling for people that have kids who are school age, all being under the same roof together has brought out a lot of stress. So stress, anxiety, depression has been big during this time as well.
So do you have advice for the people who might be experiencing this right now?
Yeah, I put together a few bullets. For one, equip yourself with good credible information from good sources, from scientific sources. I think a lot of people are spending way too much time on their devices, reading so much that it's just dominating their mind. So give yourself a break, set some limits, and get your information from good sources, and then reach out to your medical provider. I really want to hammer that home today, that we are there for you. You're not gone during this time for your mental health issues or any of your other medical issues. And video visits have really come in handy with that. But we are there to see people in clinic who need to be seen, face to face. We're hearing about a lot of people who are ignoring their symptoms of stroke or their symptoms of heart attack or their symptoms of appendicitis because they're afraid to come into the hospital. And then they're letting it go so far that they've gone, beyond a safe, spot where we could do something about it, or when it's a simpler process. So I want people to reach out and know that we're there. And these video visits are really great for mental health check-ins as well. There's things that we can do for that. Keep with your healthy daily routines, with your schedule, healthy diet, healthy exercise, healthy sleep patterns. Look into some mindfulness apps on your devices. There's Headspace and Calm are two of the real popular ones, but you can look online or on your devices for that. I really want people to connect with others through phone chats and video chats. I think that's been an interesting new avenue in all of this.
All right.
As well.
Dr. Erica, thank you so much. And we did just have some graphics up on the resources, the phone numbers that they can call as well. So thank you so much. And just putting this out there. I mean, like you said, I think it's a problem people might not even realize that they have, that they're trying to get through right now. So thank you so much. It was good seeing you, and we'll talk to you next time.
Good seeing you too. Thanks for everything. Take care.
Thanks, you too. We'll be right back after this break.